I am now pleased to introduce our first speaker, Dr. Phyllis Niolon, the Senior Scientist for Preventing Adverse Childhood Experiences in the Office of the Director of Division of Violence Prevention, National Center for Injury Prevention and Control at the Centers for Disease Control and Prevention. In this role, she coordinates their work relating to the prevention of ACEs and collaborates with both internal and external partners on advancing the field of ACEs prevention and response. We're so honored to have her with us today to share CDC's commitment to preventing ACEs. Go ahead.
Thanks so much, Catherine. And thank you all for having me here today. I'm going to start us off by just giving a little bit of background on ACEs and then talking about work that we're doing at CDC to support the prevention of ACEs. Next slide, please. Next slide, please. Thanks. Adverse childhood experiences, or ACEs, are potentially traumatic events that occur in childhood, so from birth to age 17, including witnessing or experiencing violence, experiencing neglect, but also included are aspects of the child's environment that undermine their sense of safety, stability, and bonding, such as growing up in a household with substance abuse problems, mental health problems, or parental separation or incarceration. And on the left-hand side of the screen, you'll see the traditional ACEs that were measured in the original CDC Kaiser ACEs study conducted in the 1990s. But at CDC and in the field of ACEs, there's a great recognition that these really didn't capture the full range of traumatic events that can happen to children in childhood. So on the right-hand side, you'll see what we're kind of calling expanded ACEs or additional ACEs that weren't originally measured, but certainly have the potential to be traumatic and cause toxic stress. Next slide, please. So ACEs and their associated social determinants of health, things like living in under-resourced or racially segregated neighborhoods, frequently moving, and experiencing food insecurity, all of these things can cause toxic stress, which really is an extended or prolonged activation of the stress response system. Some children may face further exposure to toxic stress from historical and ongoing traumas due to systemic racism or the impacts of multi-generational poverty, resulting from limited educational and economic opportunities. And we know now from this study on toxic stress and the biological impacts that it has on children, that the impacts are wide-ranging, from disrupted neurodevelopment and changes in the brain that can have direct results on disease, disability, and social problems, but also those neurodevelopmental changes from experiencing toxic stress can affect things like attention, decision-making, learning, and response to stress, to increase risk of becoming involved in crime and violence, using alcohol and other drugs, and engaging in other health risk behaviors. And all of these can have significant impacts on life potential, susceptibility to disease, illness, and mental health challenges over the lifespan and early death. And the effects don't stop there. They can be passed on to the next generation. This slide really just demonstrates the number of different physical, mental, and behavioral health outcomes that have been related to ACEs. And we know that there is a dose-response relationship between ACEs and all of these outcomes. So the more ACEs a person reports having experienced in childhood, the higher likelihood it is that they will develop one of these health or opportunity problems. Next slide, please. Oh, sorry, I've got behind on saying next slide, so I'm going to ask you to skip forward. So this is the slide that that really demonstrates kind of all the different health, physical health, mental health, and behavioral health outcomes that that ACEs have, and the dose-response relationship that ACEs has. I'm sorry, I got ahead of you. So the next slide. Now I'll talk some about our surveillance efforts at CDC that help us understand the prevalence of ACEs. Next slide. So the first and kind of most comprehensive way that we measure ACEs currently is through the Behavioral Risk Factor Surveillance System, or BRFSS. And this is an annual cross-sectional telephone survey of health-related risk behaviors, chronic health conditions, and use of preventative services among adult United States residents. And there is a CDC-sponsored ACEs module, which states can use to measure ACEs and their relationship between ACEs and all these other health outcomes. Next slide, please. So as of 2020, all 50 states and DC have collected ACEs data at least once from adults since 2009. So we do have a paper hopefully coming out later this year that will give us an idea of the ACEs burden across all 50 states and DC. Next slide, please. This is our vital signs on ACEs that came out in 2019 that was based on BRFSS data. This was based on data from 25 states that had used the ACEs module between 2015 and 2017 to estimate long-term health and social outcomes in adults that contribute to leading cause of illness and death and reduced access to life opportunities. We know from the BRFSS that ACEs are common. 62% of adults report at least one ACE, and as you can see from the top of that vital signs snapshot, that roughly 1 in 6, or 16%, report having experienced 4 or more ACEs in childhood. And as I said, we know that the accumulation of ACEs is linked to much higher risk of all of these outcomes. Next slide, please. So this study that the vital signs was based on found that preventing ACEs has the potential to reduce leading causes of death, such as heart disease, cancer, respiratory disease, and diabetes, and also can have that preventing ACEs can also have a positive impact on education and employment levels. Next slide, please. But measuring ACEs among adults doesn't give us a good sense of what the burden or prevalence of ACEs is now, or any ability to monitor trends or changes over time, especially if we are implementing prevention strategies in states. And if we want to understand the current burden of ACEs prevalence or monitor trends, we need to get a snapshot of ACEs from people who are still in childhood, which is where the Youth Risk Behavior Surveillance System comes in. The YRBSS is run out of CDC's Division of Adolescent and School Health. There's a national YRBS that produces national estimates of health risk behaviors. And then also there are state and local jurisdictions who administer the YRBS. And all but 4 states in the US administer the YRBS, and many large school districts and several tribal nations also administer their own YRBS. Next slide, please. In FY20, CDC got its first ever appropriation for ACEs. With this money, and part of this money, we incentivized local administrators of the YRBS to add either 8 core ACEs questions, so those really map onto those original ACEs questions on my first slide that were in the original study, or 16 core and expanded questions to their local YRBS. In 2021, 21 state and local jurisdictions added either 8 or 16 CDC-developed ACE and positive childhood experience, or PCE, questions to their YRBS surveys for the first time. And we look forward to seeing that data and starting to analyze it here very soon. Next slide, please. This just captures sort of what is in those 2 tiers of questions. So again, those who did the 8 questions, they map pretty closely onto those 8 traditional questions. We didn't ask about parental separation or divorce, and emotional and physical neglect were combined into 1 neglect question. For tier 2, the ones who added 16 questions, they added those 8 questions on ACEs, and then 2 past year incidence questions on emotional and physical abuse. 3 of what we're calling community ACE questions. Those are some of those expanded ACEs that were on the right-hand side of that original slide. These questions ask about witnessing community violence, experiencing race, discrimination based on race or ethnicity, and experiencing discrimination based on gender or sexual identity. And then finally, 3 positive childhood experiences questions as well. Next slide, please. I don't have time to go into any of these in depth, but certainly can answer questions about them. We have worked with the National Survey of Family Growth and the National Health Interview Survey to add some ACEs questions to their survey. The National Health Interview Survey is doing a pilot with adolescents, and so that enables us to look at the concordance between adolescent reports of their own ACEs and parent reports of those adolescents' ACEs. So that's going to be exciting when we get that data in. And then we've also been working with the National Survey of Children's Health, which already collects a lot of kind of those household challenge ACEs, but we are working with them to see if we can add questions on experiencing violence. Next slide, please. So preventing, sorry, I'm having some technical difficulties. Preventing ACEs is a CDC priority. Our goal is to sustain and create and sustain safe, stable, nurturing relationships and environments for all children and families, and to help children reach their full health and life potential. And it is a priority for one of the 3 stated priorities for the National Center for Injury Prevention and Control, where I sit. Next slide, please. So CDC has produced a suite of technical packages to help states and communities take advantage of the best available evidence to prevent violence, including the many types of violence and social, economic, and other exposures in the home and community that adversely affect children. The first 5 on the left-hand side of the screen are the original technical packages, and then we went through all of those and created a Preventing Adverse Childhood Experiences resource tool based on all the strategies that are evidence-based to prevent ACEs as well. Next slide, please. This is a quick snapshot of the strategies to prevent ACEs, which I'm going to quickly run through now. Next slide, please. Strengthening economic supports for families is a multi-generation strategy that addresses the needs of parents and children so that both can succeed and achieve lifelong health and well-being. The 2 approaches under this strategy are strengthening household and financial security and family-friendly work policies. Next slide, please. Changing social norms that accept or allow indifference to violence and adversity is really important in the prevention of ACEs. Approaches under this strategy include public education campaigns, legislative approaches to reduce harsh physical punishment, bystander approaches, and efforts to mobilize men and boys as allies in prevention. Next slide. The next strategy focuses on ensuring a strong start for children and paving the way for them to reach their full life potential. Approaches under this strategy include early childhood home visitation, high-quality childcare, and preschool enrichment programs with family engagement. And all of these strategies can both have evidence-based for both preventing ACEs and for mitigating the consequences of ACEs. Next slide, please. Teaching skills to help parents and youth handle stress, manage emotions, foster healthy relationships, and tackle everyday challenges of life is an important part of a comprehensive approach to prevent ACEs. Approaches under this strategy include social emotional learning programs, safe dating and healthy relationship skill programs for young people, and parenting skills and family relationship approaches. Next slide, please. The next strategy is about connecting youth to caring adults and productive after-school activities. These connections are important for both preventing ACEs and for buffering against the impact of ACEs among youth who have already experienced them. And approaches under this strategy include mentoring programs like Big Brothers Big Sisters and after-school programs. Next slide, please. This last strategy focuses on timely access to intervention and effective care, support, and treatment for children and families in which ACEs have already occurred to help mitigate the health and behavioral consequences of ACEs, strengthen children's resilience, and break the cycle of adversity. Approaches under this strategy include enhanced primary care, in which children and families are connected with referrals and resources by their healthcare providers, victim-centered services for children and adult survivors of intimate partner violence, including shelter, housing support, crisis intervention, legal intervention, and other resources. Also, treatment to lessen the harms of violence exposures for children. And then also treatment to prevent problem behavior and reduce risk for later violence among adolescents who are demonstrating risky behaviors already. And then the last approach under this strategy is family-centered substance use treatment programs. These are programs which simultaneously treat the parental substance use problems while addressing the needs of their children with this ACEs exposure. Next slide, please. So this is a slide on our Preventing Adverse Childhood Experiences Data to Action programmatic effort. As I said, in FY20, we got our first appropriation for ACEs, and this was funded after that. Out of that appropriation, these grantees are entering their third year, and they are tasked with building and enhancing an ACEs surveillance infrastructure, so some way to collect ACEs data within their state. To implement ACEs prevention strategies, so choosing a primary prevention strategy among the strategies that I just went through, and then conducting foundational activities to really support a data to action framework. So using the data that they collect in Goal 1 to inform and hone their prevention strategies among Goal 2. I also wanted to mention programmatically, we can go to the next slide, our Essentials for Childhood programmatic endeavor. These grantees are tasked with the goals that are here on this slide, and they use the strategies that are captured in the Preventing Child Abuse and Neglect technical package, which are very, very similar to the strategies that I just went through that are in the Preventing ACEs package. So these are two ways that CDC is providing support to states in order to try to really get these evidence-based strategies out into the community and support prevention of ACEs. I know I'm over time. Before I wrap up, I also just wanted to point out, and this is the next slide, that our Veto Violence website has 5 different trainings for adverse childhood experiences. The first one that you see at the top is an overview and public health approach to ACEs. It's for people of all professions and education levels and audiences. And then each of the 4 on the bottom are profession-specific ACEs trainings. So the ones for mental health providers and pediatric care providers, the 2 in the middle, have been on our website for several years. We're really excited about the bottom left is the training for educators. That was just released in July and is out in time for the new school year. And then coming this fall is a profession-specific ACEs training for faith leaders. And I'm sorry for going over time. I will stop there. On the next slide, it's just my final slide. And I'll turn it back over to Catherine now.
Thank you so much for your leadership and CDC's leadership on preventing ACEs.